If you want to know if our strategies work of keeping your loved one in ICU instead of letting them go to LTAC, stay tuned. I can give you another case study today. My name is Patrick Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. So over the last few weeks, we have worked with a client who went into ICU after encephalitis, cardiac arrest, and supposedly hypoxic brain injury. The client's family was told that their family member will not survive the intensive care stay. And if they did survive, they wouldn't have any quote unquote quality of life. And they also said that if their family member did survive, that they should end up with a tracheostomy and go to an LTAC as quickly as possible because ICU cannot look after them. Now, I have worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years. And I've been consulting and advocating for families in intensive care since 2013 here at intensivecarehotline.com. And I can very confidently say that we have saved many lives for our clients in intensive care. And you can verify that on our testimonial section at intensivecarehotline.com, or you can verify that on our intensivecarehotline.com podcast section, where we've done some interviews with our clients who verify that we saved their loved ones' life. Coming back to our case study today, so this client, was the ICU team was trying to force and coerce the client to either let their loved one die or let them do a tracheostomy and a PEG tube, to send them to LTAC as quickly as possible. Well, interestingly enough, the family didn't agree to either. We advised them to agree to a tracheostomy after about 2 weeks of mechanical ventilation and the inability to wean her off the ventilator, wean their family member off the ventilator. By the same token, the ICU team should have removed sedation much quicker to give our client's family member a better chance to be weaned off the ventilator to begin with. In any case, she did end up with a tracheostomy, no PEG tube, as per our advice. And therefore, the ICU could not send their family member, our client's family member, into LTAC, right? Therefore, they were forced to wean her off the ventilator and the tracheostomy in ICU. And lo and behold, like with many of our other clients, the ICU seems to succeed in weaning their family member off the ventilator, but they've already succeeded with that. And now their family member is very close of having the tracheostomy removed. Now, let me read out, because we've been reviewing medical records for this client. Let me read out what the doctor's notes are saying. As per the doctor's notes, the patient ate more at lunch today, which is good. And that is with the tracheostomy, but she's now got the cuff down and she's passed swallow test. That is for a patient where the family was told she's not going to survive the intensive care stay. And if she was to survive, she would never eat and drink again. And she would just be dependent on other people for the rest of her life, right? So you have to question the clinical judgment of intensive care teams, right? So let's carry on with the report. The current plan includes continuing to encourage oral intake while maintaining overnight nasogastric tube feeds to meet her nutritional needs. The volume of her tube feeds at night can also decrease if she tolerates increased oral intake during the daytime. The dietitian also needs to reassess her regularly and adjust the timing of her tube feed so it won't impact her appetite during the day, like ending tube feeds earlier in the night to promote daytime appetite and improve oral intake. They need to further investigate the cause of her nausea, as this can discourage eating. They must rule out possible causes of her nausea, such as medications, delayed gastric emptying, or electrolyte imbalances, especially if the nausea has started even before the nasogastric tube was reinserted. A gastroenterology consult or a dietitian consult might help with this. They should also fulfill her vegetarian preferences and provide small, frequent meals she enjoys to build her appetite. Otherwise, per the nurse's notes today, there are no complaints of nausea this shift. However, she's restless and had a hard time sleeping. Melatonin and Seroquel were given. They should also consider non-pharmacological measures like a relaxing shower or calming bedtime routines to improve sleep quality. Further to the notes, tracheostomy. The tracheostomy was discussed with the pulmonary service, and she will be evaluated this week when she can be decannulated, i.e. have the tracheostomy removed. Once again, keep in mind, this is a patient in ICU who was told she's not going to survive. And family was told if she was to survive, she will never have a quality of life, and she will never eat and drink again, and she will always be dependent on other people. So you have to question the ICU team's judgment in many cases. Now the report continues. Given that the patient has already been using a speaking valve, her tracheostomy tube has been downsized, and she's maintaining good oxygenation, the next step should be progressing to tracheostomy capping trials. These trials will further assess her ability to breathe effectively without the tracheostomy and prepare her for successful decannulation. In addition, she needs continued psychiatric follow-up to address her depression. She needs to be reassured about her progress and emphasizing improvements like eating better and walking, which can boost her confidence. More positive interactions can help, like those with her friends, families, who seem to lift her spirits and motivate her to eat and drink. Further medical reports are white cell count 8.33 normal, hemoglobin 11.7 normal, platelets 196 normal. Now, the progress notes further continue. Patient appears less clear about having a PEG place in our discussion today. She has always refused, and she will continue. She's continuing to refuse. We are hoping she will be able to eat enough not to need it in the first place. To date, she hasn't been able to eat enough. Even with the nasogastric tube, feed rates has been a little too much for her and had to be stopped overnight. This is where ICUs are negligent. Why would you need a PEG tube if someone is close to decannulation, is having a nasogastric tube, right? That is negligence, and a nasogastric tube will do the job. Why are they wanting surgery, i.e. a PEG tube? Why? Right? Is that to earn money with surgery? It's a question that is a relevant question. So it's really good to see that our strategies continue to work. No PEG tube often helps. Asking for hospital discharge policies help, because hospital discharge policies will say that a patient cannot go anywhere else without the consent of a patient or a family, right? And that's just a given. And the other thing that will help, the determination of a family to advocate for their critically ill loved one, right? This family here took full responsibility for outcomes, and we helped them to get the outcomes, but it also takes your determination. If you let the ICU team walk all over you, they will. If you stand up for what is right and for your rights, you will get good outcomes, and your loved one will be able to survive, have devices such as tracheostomy removed. We are very positive that this patient will go home in a few days after the tracheostomy has been removed. She's already walking, she's slowly eating and drinking. She's absolutely on the right path. That is after the family has been told she won't survive and she should have hospice, right? So, you know, sometimes I don't think I'm exaggerating when I say that ICUs are trying to deliberately kill patients to stay in control of narratives and to have some sort of population control, wanting to stay in control who can live and who can die, and that is just plain wrong. ICU's job is to put their best foot forward and do what is in the best interest of a patient and a family. We have helped hundreds of members and clients over the years here at intensivecarehotline.com with amazing outcomes. Once again, check out our testimonial section at intensivecarehotline.com, and check out our testimonial section at check out our podcast section at intensivecarehotline.com, where we have done client interviews. And with us helping hundreds and hundreds of members and clients over the years, that's why we created a membership for families of critically ill patients in intensive care. And you can become a member if you go to intensivecarehotline.com, if you click on the membership link, or if you go to intensivecaresupport.org directly in the membership. You have access to me and my team 24 hours a day in the membership area and via email. and we answer all questions intensive care related. In the membership, you also get exclusive access to 21 ebooks and 21 videos that I have personally written and recorded. And the access to me and my team and the ebook and video resources will help you to make informed decisions, have peace of mind, control, power, and influence, so that your loved one gets best care and treatment always. I also do one-on-one consulting and advocacy over the phone, Zoom, Skype, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I talk to doctors and nurses directly as well. And I ask all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. And I can hold them accountable with my clinical knowledge because I understand intensive care inside out. I also represent you in family meetings with intensive care teams. I handhold you through this once-in-a-lifetime situation that you simply can't afford to get wrong. We also do medical record reviews in real time. We also do medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have from this video. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification for the YouTube live if you are a subscriber to my email newsletter or if you are a subscriber to my YouTube channel here. Share the video with your friends and families as well. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.